Is it safe to drink caffeine while breastfeeding? The short answer is yes. Now let's talk a little bit about caffeine. If you already drank coffee while pregnant, your baby is actually used to a much higher level of caffeine than if you're drinking coffee while breastfeeding. When you're drinking coffee while pregnant, that coffee goes into your mouth, into your stomach, to your bloodstream, to the umbilical cord, to your baby, directly into their bloodstream. So if you drink coffee while pregnant, your baby's already used to quite a high dose of caffeine. Whereas when your baby is breastfeeding, your coffee goes into your mouth, into your stomach, into your bloodstream, into your breast milk, into your baby's mouth, into your baby's stomach, and into your baby's bloodstream. So the pathway is much longer, and the actual amount of caffeine that they get is significantly lower than when you're pregnant. So if you already drank coffee while pregnant, it is completely safe to continue drinking coffee while breastfeeding, knowing that your baby is already used to a higher level of caffeine. With that said, when you drink your coffee, it takes about 15 minutes for that caffeine to hit your bloodstream. It will peak in your bloodstream about 1 to 2 hours after you drink, and typically will clear from your bloodstream within 4 to 7 hours. That is for your standard cup of coffee. So if you are going to drink coffee, what I typically recommend is drink your coffee while you're breastfeeding, because by the time your baby is done breastfeeding, that should just be hitting your bloodstream, and that gives you enough time to have that peak and start coming down before your next breastfeeding session. Now, how much caffeine is considered safe? Well, the CDC recommends limiting your caffeine intake to no more than 300 milligrams of caffeine a day. That's quite a bit of caffeine. And remember, though, that every cup of coffee is going to have a different caffeine level to it. The coffee that you would brew at home is going to be different in a coffee pot versus a pour over, which will also be different than if you're going to Starbucks or another commercial coffee place. So you will want to check and make sure how much caffeine is in that cup of coffee based on the size and how that coffee is being brewed. Blonde roasts or lighter roasts do have more caffeine than darker roasts. So just be mindful of the kind of caffeine that you are brewing and how much you're taking in on a daily basis. There is also caffeine in other sources like colas and teas. The other thing I want you to be aware of is that newborn babies metabolize coffee differently than older babies. So for young babies under a few weeks, caffeine can stay in their system for 2 to 5 days, whereas by the time a baby is 4 to 7 months old, that caffeine metabolism is the same as adults. It's about 4 to 7 hours for it to completely metabolize through their system. So if you did not drink coffee while you were pregnant and you want to start drinking coffee again, what I recommend is go low and slow. Have a small cup, maybe a half calf or a decaf to start, a really small cup first thing in the morning while you're breastfeeding, and look for any issues in your baby. What you're looking for is jitteriness, irritability, and not being able to transition to sleep. Now, sometimes the irritability and not transitioning to sleep is because you have a newborn, but if you're seeing that in relation to about 2, 3, 4 hours after you're drinking that coffee, your baby is jittery and not sleeping well or not transitioning to sleep, you might want to consider cutting back on your caffeine, doing a smaller cup earlier in the day or at a different time, or waiting until your baby's a little older. Remember, as baby's liver matures, which is around 3 months, as they start to metabolize that caffeine at the same rate that we do, you might see those symptoms go down. Every baby is different in what their unique system can handle. So one baby may be able to tolerate their mother drinking lots of coffee while breastfeeding, and another baby, they may be more sensitive to it. So it is not a one-size-fits-all approach. Now you know.